Hi, this is Dr. Moore, and you're listening to a recorded PowerPoint that was done to help prepare you for your dosage calculation exam, which will happen in the first 5 days of class in the beginning of your senior semester. So we made this PowerPoint to help you focus your preparation, and the things that we're mentioning here will be on the exam. We'll review them again in a live class, and I'm going to try and emphasize some of the areas that have caused students problems in the past. I should say now, and we'll say to you again several times, you're going to have to take exams like this even for routine hospital jobs. Some of the places I've applied in my life haven't even wanted to give me an application till I showed them I could pass a math test. So if you're wondering when will I ever use this again, the answer is plenty. And knock on wood, because they're saying this hurricane season yet could be bad. If there's another hurricane like Ike, some of you will find out in clinical settings how fast you run out of battery on a calculator and have to do things manually, can't rely on machines. So some of this will be flat review, like what's about to be on this slide. Rounding rules. Rounding is a way of taking a larger number, usually with lots of decimals, and reducing it to something that's more manageable. We have rules here at the School of Nursing. Doses that are less than 1.0, you round those to the nearest hundredth. That's because these are very small amounts, and there's quite a bit of difference in those hundredths, particularly when we're talking about a premature infant or an elderly person on dialysis who has very tight requirements, or someone in liver failure. Those hundredths can make the difference between effective and non-effective in terms of pain relief, in terms of treatment outcomes, in terms of infection. So hundredths below 1. Greater than 1, we go to tenths. Most Alaris pumps can be programmed, for instance, to tenths. So that's part of the rationale. Many computerized charting systems will only take numbers up to, say, hundredths maximum, and prefer them in some places in the record to be tenths. So there are practical reasons why we round these numbers. You only round at the end. Every time you round, you're shaving, you're cutting, or you're adding and expanding. You're altering your answer just a little. To do it once is one thing, but to do it repetitively will actually change your answer significantly. So only do the rounding step at the very end. Labeling. When you write your answers on the exams, always include the unit of measure. Even now, when I've worked as a staff nurse, if I'm doing a calculation to double check it, oftentimes the first thing I do is write down, where am I going? Like, what's the desired unit of measure? And what am I starting with? It helps me to keep my work anchored. So if you find that helpful, have at it. I just find it's very much a helpful thing for me to do. And I know some of the students that we've taught have found it helpful because it has to happen. You just do it automatically, write that unit down, and then work your math. It's just another way to check yourself. So in this example, 0.862 becomes 0.86 using the rounding rule above of less than 1. 1.862 would become 1.9 because we're using the rounding rule for numbers greater than 1.0. Weight-based calculations. You have to be clear about what system is being used. the largest part of confusion for students and even for working nurses and doctors comes from the fact that our patients speak pounds and ounces. But to do drug calculations, we speak grams and kilograms. In most units, babies, well, we used to weigh them in pounds and ounces. Now, scales weigh them in grams and kilograms. But if you're dealing with a place that can't or doesn't, for instance, with adults, in some ICUs, part of the night shift job is to put the patient on a bed scale, weigh them, and then double check the calculated weight. And that number often goes on a clipboard or on a blackboard or a whiteboard by the patient's bed, because in a code, nobody wants to be trying to calculate that patient's weight. We just want to have it in a place where it's very readily accessible. So when you're reading a question, are you getting your information in pounds and ounces, or are you getting it in grams and kilograms? Be clear. There are some equivalencies that you should just tattoo in your head. 16 ounces in a pound, 16, okay? And ounces are often abbreviated OZ. Pound can be abbreviated with the hashtag or abbreviated LB. 2.2 pounds, again, hashtag or LB, in 1 kilogram. So you need those two equivalents to do weight-based calculations. So let's take 13 pounds, 9 ounces, and convert it to kilograms. The first thing you have to do is figure out what percentage of 16 ounces is 9 ounces. Because 9 ounces is a round number, but the equivalency for pounds to kilograms right here is decimals. It's 2.2, 2/10 of a pound, okay, which is 3.2 ounces. So what you do is take 9 ounces divided by 16 ounces, and that becomes 9/16. So you just divide it out, and you end up with 0.5625. You notice I'm not rounding this number. I just write it down. And now, instead of 13 pounds, 9 ounces, I have 13.5625. So now, pounds. So now I have pounds and pounds speaking the same language, because my numbers, instead of being expressed as ounces, are being expressed as fractions or decimals in relationship to how much is in 1 pound. Now, if I take pounds divided by pounds per kilo, I end up with it looking this way. The pounds cancel out, the kilos cancel out, okay? And I end up with 13.5625 divided by 2.2, 6.164 kilograms. And again, I'm not rounding, because I'm typically going to be taking that number and putting it into another equation. I mean, in the real world, the only reason why I care that 13 pounds, 9 ounces is 13.5625 is because I'm probably going to be doing a milligram per kilogram drug calculation. Okay? So, don't round this. So, let's talk about some of the things we're going to do. One of them is determining the safe dosage range. Most of you are going to find that within your first 2 years of working, and depending on where you work, it might happen sooner, you will save a physician trainee or a nurse practitioner trainee from doing something really bad. And often it's because you know what those safe dosage ranges are. You give the medication very frequently, and you're dealing with a practitioner who's training who maybe has only ordered it once or twice. you'll pick up those math errors right away. So here, you might need to take milligrams or micrograms to grams to determine doses based on weight. You've got to work up and down. So you have to remember that there are 1,000 milligrams in a gram, and there are 1,000 micrograms in mcg in a milligram. So let's walk through it. You have a drug that's ordered to be given 7 micrograms per kilogram per day IV, intravenously. Your patient weighs 82 kilograms because someone's helpfully done that math for you. Your drug is dispensed in milligrams. So right away, I see I'm good here because I've got kilos already, right? But I got a problem here because I have milligrams per mil and I need micrograms. So right off the bat, I see I've got to do some equivalencies, some calculations. So I like to know, first of all, how many micrograms are in 0.25 milligrams. And you can see the math here. 0.25 milligrams equals X number of micrograms. So 0.25 milligrams equals 1,000 micrograms per milligram, right here. So here's the math worked out. Micrograms cancel, milligrams cancel. Multiply 0.25 times 1,000, you get 250 micrograms per milliliter of solution. The total dose for your patient is 7 micrograms per kilo times 82 kilos, 574 micrograms total dose. So you'll take that 574 microgram total daily dose, divide it by 250 micrograms per mil. And the math down here looks this way. Again, the micrograms would cancel, the milliliters cancel. You end up with 574 divided by 250, or 2.296 milliliters of solution that rounds to 2.3. Safe dosage. So, for example, the neonatal vancomycin range at certain weights is 10 to 15 milligrams per kilogram every 8 to 12 hours. Now, when we don't say milligrams per kilograms per day, we're asking you for the dose. You have to pay attention to that. So, we're going to determine the safe dosage range based on taking each end of the range, 10 and 15, converting it with the patient's weight to their personal range for a safe daily dose, if it says milligrams per kilograms per day, or in this example, we're just going to determine what each dose should be. You have to pay attention to the frequency that a drug is ordered at. So if we say you can only have 10 to 15 milligrams per kilogram per day, and you give it every 8 to 12 hours, that daily amount has to be divvied up. If it's once a day, you give it all at one time. If it's BID or twice per day or Q12, that dose gets split in half. If it's 3 times a day or Q8 or TID, you give a third of the total amount for the day per dose. QID, 4 times a day or Q6 in 4 doses. So you want to be careful. What are we asking you for? Are we asking you for the range per day. Oftentimes, chemotherapeutic agents and some antibiotics are ordered per day. So, how much can accumulate in 24 hours? Other medications may be written per dose, just so that you don't put too much into someone's system at one time. So here's a little video.
I just received this drug calculation problem from a nursing student, and I think it's essential that the nursing students out there are able to do this just in case I'm the patient receiving the drug. So let's do it. And I think it's an interesting unit conversion problem for pretty much anyone who wants practice with unit conversion. So the question is that we have a doctor. The doctor orders drug X. Drug X, and this is the dosage that the doctor's requesting. They're saying 5 milligrams of our drug per pound of patient weight. I'll just write per pound of patient weight every 12 hours. This is what we're supposed to do, but our supply of the drug, our supply right here, our supply in green, it isn't just, it's not just nuggets and milligrams. It's a solution. There's a certain amount of grams for every milliliter that we have of the solution. It's dissolved in maybe probably some water. So this is our supply of drug X. Drug X. We have 0.9, I'll write a 0 in front. My wife, who is a doctor, says it's essential to write the 0 in front of the decimal. We have 0.9 grams per milliliter of solution. So if I were to take 1 milliliter out of my solution and give it to someone, I'm essentially giving them 0.9 grams of this drug. And then the final piece of information we're given is that the patient, they weigh, maybe we should say they mass, because kilograms is mass, but we get the idea. The patient is 72.7 kilograms. 72.7 kilograms. So there's a couple of interesting things here. We have to figure out the dosage in terms of milliliters. We have to, actually I even tell you the question. We have to say, the question is, how many milliliters of solution do we have to give to the parent per dose, to the patient per dose? So milliliters of solution per dose. That's our question. And there's a couple of things. We have to go from milligrams to grams, and then convert that to milliliters, and then they tell us per pound, but then they gave us the patient's weight or their mass in kilograms. We have to do some conversion there. So I definitely can appreciate how this can be a little daunting and maybe confusing at times. So let's just do it step by step. So the first interesting thing, and this is just something that you might need to know, or you might have it written down on paper, or you might have a calculator that does this, is just how to convert kilograms to pounds. It's good to know in general if you're converting between the metric and the English systems. So 1 kilogram is approximately equal to 2.2 pounds. Not exactly, but that's a pretty good approximation. And 1 pound, if you just take 1 over that, 1 pound is approximately Sal know to multiply by 2.2 instead of dividing by 2.2, which is the same thing as multiplying by 0.5. You can pay very close attention to the units. Notice I wrote 2.2 pounds per kilogram, 2.2 pounds per 1 kilogram. And you'll notice this will work out because you have a pound in the numerator and you have a pound in the denominator. That's called dimensional analysis, but it's a very, if you ever get confused with these things, and I think once you do enough practice, you'll find that you won't have to pay too much attention to this. But at first, when you're getting started, just to make sure you're not, multiplying or dividing by the wrong thing, just make sure the dimensions cancel out. Pounds in the numerator, pounds in the denominator. So let's do that. Pounds in the numerator, pounds in the denominator cancel out. And you multiply 5 times 2.2. 5 times 2.2. This is equal to 5 times 2 is 10. 5 times 0.2 is 1, so this is equal to 11. And then in our numerator, we have milligrams. 11 milligrams per kilogram. So we've just converted our dosage information to a pure metric system. I mean, it was actually a mix between the metric and the English system before. Now let's see what we can do. Well, let's see if we can get it in terms of how many milliliters we have to deliver per pound. So once again, we want this, well actually let's go to grams first, because we have milligrams here, we have grams up here. So let's see if we can convert this thing to grams. So just like we did before, we want a milligrams in the denominator. I'll put it in orange. We want a milligrams in the denominator, and we want a gram in the numerator. Why did I say that? Because I want this and this to cancel out, and I want a grams in the numerator. So how many grams are there per milligram? You can just think it through. There's 1 gram per 1,000 milligrams, or 1,000 milligrams per gram. And you just multiply it out. So the milligrams cancels with the milligrams, and then we get this is equal to 11 over 1,000 grams per kilogram. Grams per kilogram. So now we have everything in terms of grams, but we want it in terms of milliliters. The question is, how many milliliters of solution per dose? So let me go down here on this line right here. So we had this result. We have 11 over 1,000. I won't do the division just yet. Grams of drug X per kilogram. This is really just we've just rewritten this dosage information in different units. And let's see how much solution we need per kilogram. So what I want to cancel out the grams here and have a milliliters there. So to cancel out that grams, I'm going to have a gram in the denominator and a milliliter in the numerator. And a milliliter in the numerator. So in our solution, how many grams are there per milliliter? Well, they told us there's 0.9 grams per milliliter. Or, for every 1 milliliter, there are 0.9 grams. Notice I just took the inverse of that because we want a milliliter in the numerator, grams in the denominator, so that these two cancel out. And let's do this multiplication now. So our grams cancel out. We have milliliters per kilogram. Milliliters per kilogram. And then we multiply out 11 over 1,000 times 1 over 0.9. So let me just write it like this. So this is going to be 11 over 1,000 times 0.9 milliliters of our solution per kilogram. So we've gotten this far. So this is per kilogram of patient body weight. And then finally, they tell us how many kilograms our patient weighs. So let's do that last multiplication, and then we can actually get our calculator out and do it all at once. So let's multiply this times. We want to know how many milliliters per patient. We want the kilograms to cancel out, so we want kilograms per patient. And we're talking about this particular patient. Not every patient is going to be the same number of kilograms. But if we do this, kilograms will cancel out. We'll have milliliters per patient, milliliters of solution per patient, which is exactly what we want. We want milliliters of solution per dose per patient. But everything we've assumed so far has been per dose. So how many kilograms does a patient weigh? Well, there's 72.7 kilograms per patient. That's how much the patient weighs. So we just do this final multiplication and we'll be done. So our answer, and these two things are going to cancel out. So our final answer is going to be 11 times 72.7 divided by 100 times.
So a couple of things. You probably noticed that the rounding rule wasn't correctly followed there. If it was 0.8888, we would round it here to 0.89. Remember, 2 places after the decimal. Yes, a pound or a kilo, no, I take that back. A pound is approximately 0.45 kilos, but don't play with that number. Just play with 2.2 pounds per kilogram. All right. It's a good thing to remember, again, is what I like to call a rough check on your math. That if a patient weighs 150 pounds and you've done the pounds to kilograms correctly, your number should be somewhere below 75. Otherwise, you did something pretty wrong. And not too far below it. Do you see what I mean? Because 0.45 is a little less than half, but not a lot less than half. Common sense checks that we'll talk to you about in the review that we do live. Khan Academy has other videos. I'm not certainly trying to suggest that that's the only one, but I thought with the chalkboard app, it does a nice job of walking through how you can set up these problems. Feel free to look at other ones. Magnesium sulfate. So now we're walking into obstetric territory. Magnesium sulfate is a medication we use primarily in obstetrics to prevent seizures in preeclampsia. Eclampsia is a term for a seizure in a pregnant woman who doesn't have any other good reasons to seize. Okay? Seizing is bad. Mothers and babies get very hypoxic. Repetitive seizing can be damaging to a fetus. We don't like it. Also, in eclampsia, when things progress to seizing, there's quite a bit of damaging sequelae going on. So this is a situation we want to intervene in and hopefully prevent. So that's the primary use for it. Because it's a shutting down drug, is the way I think of it. We also use it to shut down a uterus in preterm labor. We found that in the early preemies, the 20-ish weekers particularly, that giving mom magnesium sulfate seems to help prevent brain bleeds in the baby. Again, it won't be on your dosage calculation, but I think it's helpful if you know why we're talking about this medication. Gosh, it's fairly unique. We don't use lidocaine very much. We used to use it more, but the algorithms for advanced cardiac life support have changed, and I just don't see it ordered a whole lot. And I'm pretty sure that's the only other thing that is dispensed in unusual amounts. So magnesium sulfate has a standard concentration in most area hospitals, and it's either in a 1 liter bag and there's 80 grams in it, or if they're sending up a smaller bag, it's 40 grams and 500, which common sense again says these are the same concentrations, because if you take 500 and multiply it times 2, you get 1,000. Take 40 and multiply times 2, you get 80. So the proportion of drug to solution is unchanged. So that's the answer to the first question. The drug is commonly ordered with what's called a loading dose and an hourly rate. For seizing, loading doses are commonly 4 to 6 grams. Sometimes for preterm labor, they're a little bit smaller. But still, the doctor will ask you sometimes to give a certain amount to get blood levels up in a hurry. This is the thinking. In low resource and third world settings, if magnesium sulfate is used, it's used intramuscular because giving an IM injection is cheaper than the equipment to run an IV on a pump. That makes sense, okay? So loading doses anyway for preeclampsia are commonly 4 to 6 grams. Hourly rates are commonly 2 to 3 grams per hour IV. Right? So the first thing I like to suggest is that you figure out how many grams per milliliter using the above concentrations. Because again, if everything's ordered as grams, I need to make this thing continue to speak grams to me, or I can't do the math. So if I do that calculation, I get 0.08 grams per milliliter. So if I want to give 2 grams per hour, all right, I have to take 2 grams and divide 0.08 into it, and I will get 25 milliliters per hour, or 2 grams of magnesium sulfate. That's pretty standard. Students are always surprised when they've already told me the patient's on 2 grams per hour and they're having trouble doing the intake and output. I'll say, well, your mag is 25 per hour because, again, these concentrations are standard. Oxytocin. This is a medication that we use for a variety of things. Basically, it makes the uterus contract. That means that we can make it contract to stop a hemorrhage. We can make it contract to get a baby out. We can make it contract, and we can make placentas contract sometimes by directly injecting oxytocin into the placenta after the baby delivers. We can use low doses along with other devices to do cervical ripening. But the end result of any of these things is your uterus is going to contract. It's supplied in units. One vial typically has 10 units of oxytocin. You can give it intramuscularly. So I will tell you that generally in a birth center or in a home delivery, a certified nurse midwife would usually give the medication IM unless the patient had a high risk for bleeding. There was some reason they had a hep block or an IV location in place. But generally speaking, our women don't in those settings. So we're going to give them an injection in the leg. Otherwise, the medicine is mixed in solution and hung with a pump as an IV. 1 unit of oxytocin has 1,000 milliunits. 1,000 milliunits. And the drug is ordered in milliunits per minute for intravenous use. So induction doses commonly start at 1 to 2 milliunits per minute, and they'll be increased twice an hour, 4 times an hour, 6 times an hour. And typically in hospitals with physicians, you may see them go up to as much as 40 milliunits per minute as needed. Depends on the hospital, the protocols, the orders, the physician, many things. Concentrations that are mixed for induction and commonly used are 20 units. So that would be 2 vials in a 1 liter bag, 1,000 milliliters in a liter, or 30 units, which is 3 vials, typically 3 milliliters, in 500 mils for IV infusion. The advantage here is that we're using less solution to deliver drug. One of the side effects of oxytocin when you give it IV is that it makes you retain fluid. So if we can administer it with less fluid, we're not adding to that problem. So if you're using 30 units in 500 milliliters, how many milliunits per mil? So basically, it's going to work out to be 60. You take 30 units and you multiply that times 1,000 milliunits per unit. So there are 30,000 milliunits in that bag, and it's 500 mils. Following? So you take 30,000 divided by 500 and you get 60. So if you know you have 60 milliunits per mil and the dose is 2 milliunits per minute, how much are you giving per hour? So here's your answer. 2. You do 2 milliunits per minute. There are 60 minutes in an hour. So basically, in an hour, I'm going to give 120 milliunits divided by 60 milliunits per mil, 2 milliliters per hour is going to deliver that medication. Now, what I do to do my Pitocin or oxytocin calculations is a variation of dimensional analysis. I do it this way because it makes sense to me and because I am really bad at memorizing equations, and mostly because I have seen some really bad and egregious stuff happen because of confusion around how to set up an equation. So I've got the fear of bad things I've seen happen and the fact that I'm not particularly good at it. So I can follow this out. It makes sense to me. We don't require you to do the calculation in a particular way. You have to show your work because especially when you're not successful, we can't help you if we can't see what you did, number one. Number two, if you don't write down your work, for all we know, you're copying an answer or you've memorized things. You got to show us how you got there. Your textbook is going to teach you to use an equation. If you do use it, remember to round the answers you get to whole numbers. Tattoo that one in your head. We don't generally order oxytocin in anything but whole numbers. Just know that and work that way. Because if you don't make those answers a whole number, you will get it wrong. Oral medications. Similar to what we've already talked about with safe daily dose, you need to know what's the total daily dose and how often is it being given. So is the patient safe? Acetaminophen or Tylenol is 4,000 milligrams per day. That's your max dose to be safe. Ibuprofen is 3,200 milligrams a day for adults. Pediatric for these two meds is weight-based. So when you're looking at dosage in general for oral meds, what are you being asked to give and what do you have? Read it to see if we're asking you for a daily amount or a single dose. Double check any answers that are larger than an 8-ounce or 240 milliliter bottle or more than 3 tablets. For instance, just common sense, which saves most of us from making really horrific errors. If I need to take a big amount and make it smaller, like if I'm being asked to take a 4,000 milligram per day dose and give 4 doses, and I end up with 10,000. Okay, guys, common sense. If I give 10,000 4 times, that's more than 4,000, but 10,000 for 1 dose out of 4 is bigger than the total daily. So right away when I see that number, I should be like, whoop, I made a mistake. Okay? And then remember some common equivalencies for oral solutions. There are 30 milliliters in an ounce, 15 milliliters in a tablespoon, and 5 milliliters in a teaspoon. Intramuscular injections, we give those to put medication deep in the muscle. Typically for an adult, volumes are less than 3 milliliters. But you can go as high as 5. Pediatric and neonatal doses. Actually, I've given some newborn doses as small as 1/10 of a milliliter. 1/10. So your patient has a medication that's 350 milligrams per milliliters. 600 milligrams is the ordered dose. How much are you giving in milliliters? So basically, I'm going to take 600, that's the ordered dose, and I'm going to divide it by 350 because that's what I have. That's where that number comes from, and it rounds to 1.7. If I have a medication that's 350 milligrams per mil, and we order 200, 200 divided by 350 comes out to 0.571. Again, less than 1, we round it to 0.57. So, calculating drip rates. You know, we use tubing to connect the intravenous solution, the medication, or the blood product, like packed cells, platelets that are pooled, or even in trauma, sometimes actual whole blood, although that's not common, to whatever the patient is using for intravenous access. Jugular line, a Hickman, a central line of a different type, a Heplock, some kind of peripheral, a PICC line, all that good stuff. So different tubing has different drop factors. And when we see you guys on Wednesday morning, we'll show you a picture to suggest where you might find that on the packaging for the tubing. But know that piggyback tubing, the stuff we use for antibiotics, is 10 drops per mil because we typically want that to run faster. So you don't have to wait for as many things to drip to make a milliliter. Blood tubing, the kind that you hang to gravity, is typically also 10 drops per mil. We don't want to use really tiny tubing. And again, we have a 4-hour limit on a unit of packed cells. Primary IV lines and some IV pumps that I've worked with are 15 drops per mil. Alaris tubing, which is the kind of IV pumps you're going to see in the lab and also in the hospitals, in the Woodlands, is 20. And then finally, there's something called a mini dripper or a Buratrol. These typically have a plastic drip chamber that holds, off the top of my head, I want to say about 100 mils. And there's at the bottom of that chamber, in the actual place where it drips, is a needle, and it makes tiny, tiny drops, 60 per mil. So knowing the drip rate helps you to calculate the per minute rate needed to achieve the flow rate. So if we say 100 mils per hour, then that's going to be 1,000 drops in an hour. It's going to be 1,500 drops. It's going to be 2,000. It's going to be 6,000. So in this example below, you'll see that an order for 60 drops per mil with 15 drops per milliliter is written. So the hourly dose is the number of drops, here 15, times the mils per hour. And that equals 900 drops per hour. So 900 divided by 60 is 15. Okay? And then finally, here are some online and phone applications to help you. They all feature Dr. Moore's favorite price in the whole world, free. So here's a link to a site that does dosage help. Here's a link to the University of North Carolina at Chapel Hill. Here's a link to the Del Mar Cengage calculation site. And then finally, here's one called Medication Math for the nursing student. Hippocrates, which I believe many of you have, is available both in Google Play or the App Store. The free version even has a dosage calculator under calculators. And what I recommend to students all the time is take out your phone the night before clinical, open up Hippocrates. Because if it's had updates since you last used it, you want to do that at home on your Wi-Fi because you're not needing it, if that makes sense. That way, when you go to clinical, it's all ready to go. Okay? So that